Hello, my name is Martha and welcome to a presentation on our research regarding frailty with the Perioperative Quality Improvement Programme. PQIP is an ongoing UK-based prospective multicentre observational cohort study of adults having elective major non-cardiac surgery. PQIP started collecting frailty data using the Clinical Frailty Scale in March 2018. The CFS is a 9-point screening tool that identifies the baseline level of frailty in patients. A score of 4 and above indicates frailty. The aims of this cohort analysis were to establish the relationships of CFS with adverse short-term postoperative outcomes. We also wanted to see if frailty had an impact on these outcomes in younger patients under the age of 65 years. Outcomes were measured using the Clavian-Dindo score for complications and the postoperative morbidity survey. We included data from March 2018 to February 2020. And performed multi-level, multivariable logistic regression to adjust for confounding variables and site variability. 11,008 patients had a preoperative frailty assessment. The incidence of frailty in the whole cohort was 13.6% and 7.9% in those under the age of 65 years. Almost a quarter of patients experienced major complication during their primary surgical admission, and 15.3% experienced major morbidity on day 7. This table shows that increased CFS is associated with increased odds of major complications and major morbidity, and that this relationship starts below the threshold for frailty. Subgroup analysis in those under the age of 65 years shows a similar association, with the exception that CFS scores of 2 and 3 are not associated with increased odds of major morbidity. We believe that this is the largest study using the Clinical Frailty Scale in this setting and the first to assess the impact of frailty on a large cohort of younger patients. We have shown that there is a significant burden of frailty in this patient group and that increased CFS scores are independently associated with worse short-term postoperative outcomes. Therefore, frailty assessment is of value to all patients regardless of age, and patients with scores of 4 and above should be identified as early as possible in their perioperative pathway to aid decision-making and allow consideration for targeted interventions. In addition to these patients, those with scores of 2 and 3 may benefit from improving general fitness. Limitations include the fact that a large number of patients did not have a perioperative frailty assessment and so were not included in our analysis. There may be unmeasured confounders that were not adjusted for, and our findings may not be universally applicable to different healthcare settings. Future research should include patient-reported outcomes, longer-term outcomes, and effectiveness of frailty interventions.